Hello. You enjoying yourself? This is awesome. You know, they put me on at 710. You know what 710 means? You know where that came from? Grateful Dead lived at 710 Asbury. That's where it came from. Okay, so topic that I'm going to be talking about, and I'm going to try to make it real simple because we don't have a lot of time, is worker safety for chemicals. My background in environmental health and safety taught me a lot about chemicals. Pesticides are chemicals. We have some issues with pesticides. This is a new industry. So if people don't know what they're doing, they might think a little bit is good, a lot is better. And that's not the way it works. So the petrochemical industry started in the 20th century as a wonder drug, you know, food, all this good stuff, agricultural. We found there's a lot of harm in it. So we know what the harms are to workers. And that's what I want to stress, that even though if you need to use pesticides, there are safe ways to do it. What's called the worker protection standards are promulgated by EPA. OSHA enforces, and in our state we're really lucky. We have a good group, Oregon OSHA. They're fabulous. They work with the Oregon Department of Agriculture, and they've been doing pesticide joint inspections for 10 years. Not on cannabis, mind you, but now they're starting on cannabis. And they had a pesticide symposium with all the agencies, and those were the two best agencies I found to work with. They have a communication directive. So if you're interested in the industry or if you're in an industry, ask them questions. Plus, in this state, we have a 211 system. If you dial 211, you can find information on pesticides. That's already set up and budgeted, but we need to keep that going. So there are resources. And unfortunately, you can't use the USDA organic on a cannabis label because of the federal prohibitions. But a lot of people are growing with good practices, best practices. Talk to people that are growing. We've had a lot of people already and more to come that are growers that really know the plant. And testing has to do with not just the plant, the end product, but what you're putting into it. Cannabis absorbs a lot. So things like soil, we've heard expertise on soil. That's really important to know what you're nurturing your plant with, as well as water. So there's a lot of evidence on what chemicals do with workers, and that's the real exposure, the direct exposure. What's in the product, hopefully, is minimized. And there's a lot of new advanced techniques on what's called remediation. So if we have problems, we'll be able to clarify that, the product. And so we have two different methods, basically. There's a lot more, but two different methods of use, which is basically inhalation and ingestion, to make it simple. And that's the issue. And so if there's cannabis that's going to be inhaled, maybe that ought to be a little bit different in terms of how we label it, how we talk about it, how we test it, how we use it, versus ingestion, because it's run through a different part of our body. Did you know we all make cannabinoids internally? Endocannabinoid system? So one of the theories by Dr. Ethan Russo is maybe some people are deficient. That's why we have disease. What's the solution? Cannabis. This is it's an ancient herb, and as a health professional, I'm excited to see the opportunities in what we can do. But the workforce itself, and also we heard things about employee engagement, that's critical. I think the employee-employer engagement is the key piece to making this work. So what we need, though, and we don't have, is real data. You know, it's been illegal for a long time, so people didn't know what to do, or the market drove, obviously, bad practices. So where we are now, we're not quite there, but there are things like what's called worker protection standards. You can Google this, WPS, and lots of good information. You know, everybody in the industry needs some level of awareness, but the workers need a higher level of training. And then the applicators, that's a special need, a special process, need more extensive training. So if you're going to use those, and there may be times you need to use them until we evolve the processes, that's important to do. But the big solution is education. I think there's a lot of information on the internet, but there is no compendium. There is no single source you can go to. So that's part of what I do. When I do education, I'm a teacher, so I rely on my students to help me. I've learned a lot from people, from my patients, from growers, from other people in the industry I've been working with for about 4 years. And I think Oregon's fabulous. We are doing some of the best growers I've met. I've gone on the East Coast. They can't even touch what we're doing out here. I think they're getting their stuff from here. Maybe. So I really do think people really are, we have a relationship with the plant here that's different from the rest of the United States, I think. That's the other thing. Growers, I found, and if you're doing it yourself, it's a fabulous way to learn because it's not something you can put in the ground and just leave like corn. It takes some love, it takes some energy, and everybody has their own way of growing, and there's nothing wrong with that. So what I want to say is, as far as lab standards, we've had some debate in here. I don't know if you're all aware, but until the end of April, April 30th, you still have time to comment on the lab standards to the Oregon Health Authority. Okay, so look that up and see what that's about. There's debate about rolling them back, which is basically trying to do another thing with agriculture. I think we've got pretty good standards here. I mean, the growing practices probably make the biggest difference in having a clean product. And just a couple tips. Like I heard earlier, and you all heard it about going and looking at webinars. There's lots of them around. They're free. Seminars. We do a lot of stuff in Oregon. Every city imaginable has local growers and experts that know what they're doing. But you really need to ask, and I think this is where we're going in the future, is understand if you buy a product at a store, it's legal, it's been tested, and that's a good thing. If it's illegal, you know, you really have to kind of trust your source. So what we need to have is a little bit better disclosure, I think. You know, have you used pesticides? What is your process? And understand and get standardization for best work practices. And that's what the industry's moving toward. I see a lot of collaboration. That's why I like this industry. I love the people that are in it, that have been in it for a while. And there's also a risk. If you're a business owner, we heard before about OSHA. The best way to get to know OSHA is call them. You know, just get to know them and have a relationship. You don't want to be inspected when you got a problem or an injury. There's a lot of resources online for that. And cannabis, I think the OSHA folks are really interested. There was a CDC study in Washington State that was just released. People know Farmer Tom? Anybody know? Yeah. It was his farm. And they came out, did an investigation. It was all cooperative, voluntary, and they were looking for mold. They didn't find much. But they looked at the rest of the practices. So that publication is going to be really important. It's like a good baseline because what CDC does is they provide their research to OSHA. And those regulations come from not only public input, but from that research. So I was on a March for Science. Anybody else there? That's what we're talking about. This is science. I believe in empirical stuff, the reality of what's happening and practical. So if you're a business owner, consider that insurance doesn't cover everything, and that one of the keys with employee engagement is getting people to tell you when there's a problem. Okay? You don't want problems hidden, because how do you know to fix something unless people tell you? So that engagement, as well as being out in the field, that's what I like, and I think a lot of people are interested in that. One thing I'm really concerned about, though, is over-regulation, and I think that's really kind of hurt us to some degree. I don't think it was intentional, but I've been lobbying our legislature for about 3 years, and the lawmakers and the regulators are getting a good education finally. They're understanding, especially I really have to hand it to our joint committee, they call it, the joint bicameral Democrat, Republican, Senator, Legislator Committee. Senator Ted Fiorioli, I had no idea how good this guy was. He's been great for our industry. Floyd Brzezinski, no question, he's awesome. A new representative, Ken Helm, actually understands land use. So we've got people in place that really understand this to make sense out of the laws. It's the regulatory piece that is in silos that we're trying to work with. And just get involved in that case. There's regulatory hearings. Like I said, there's opportunities to comment to the testing rules. And really, I look for facts and evidence. So it was a little concerning when the OHA came out with some information that wasn't quite factual, so we had to help correct it. But in closing, I'd like to point out that one of the reasons and the passions I do this is to help people in suffering. And so that 22 stands for 22 plus vets every day die of suicide. Mostly PSD, a lot of medication interactions. But I met some wonderful vets back in D.C., and thanks to our Congressman Blumenauer, I really think we're going to be able to help them. And that will open, because the Veterans Administration has one of the best electronic medical records. That, you know, once we get this broken open and everybody's willing to collaborate and do the research, we're going to find a lot more opportunities for this plant than we ever knew. I think we know a lot now, but we're going to find a lot more out. So I'm really looking forward to that. And it's all about the culture. So thank you for your attention.